So what I appreciate most about the way we now hand over is the thorough checking that we do of our nursing documentation. From the nurse handing over to the nurse taking over, we go through the three most important pieces of documentation, which is our nursing cardex, our Pew's charts and our fluid balance. For me, I like the double checking of that, to know that you've attended to your care and that in explaining you can see clearly what you've done and what you haven't done.
I feel that the new handover has benefited me in many ways. I suppose some of them that have been more prevalent has been being able to visualise the patient at the bedside, being able to look at them and see where they are in their term of care and their need of care, and seeing what I need to do to prioritise their care. Another thing that has been a great benefit with the new handover is being able to look at the equipment at the bedside. That can include checking the working order of the oxygen and suction, and making sure that they are, because you never know when you might need to use them in an emergency situation, and that can arise at any time.
As one of the consultants on the ward, I find that there's two things that really I've noticed a big difference with the new handover. I suppose because the nurses who are coming to the medical handover have been round and have seen and assessed all the patients beforehand, to be able to highlight to us during the medical handover actually what parents are feeling and where they're worried, and so it means that we can adjust and triage our patients, and maybe I would go to see different patients more quickly than I would maybe have done before, because I know which ones I need to see more sooner. So I certainly feel that from my perspective, medical handover is so much clearer because nursing information helps me triage my day much better, but from a parent's perspective they are more empowered to actually ask the questions that they need of me, so I can answer and help them more appropriately.
Well, we're happy that we know which member of staff is going to be looking after our child, and we know that the day staff have passed on all the information fully. We feel part of that as well because we're involved, and we know that, but especially because Jamie's a child with complex needs, there are a lot of sometimes issues, different ways of administering medication, so we're confident that this is all passed on, and if we ever have to leave the ward, we're confident and happy that he's going to be well cared for. Well, we're happy that we know which member of staff is going to be looking after our child, and we know that the day staff have passed on all the information fully. We feel part of that as well because we're involved, and we know that, but especially because Jamie's a child with complex needs, there are a lot of sometimes issues, different ways of administering medication, so we're confident that this is all passed on, and if we ever have to leave the ward, we're confident and happy that he's going to be well cared for.